This documentary is produced on the lands of the Wurundjeri Woi Wurrung people, and we wish to pay our respects to elders, past, present and emerging.
Mental Health Foundation is the oldest mental health organisation established in Australia. They have a history. My journey started with Mental Health Foundation in 1992 as a volunteer. When I couldn't find a job during the recession, I was planning to assist people who were struggling like me. That's where it brought me into this organisation as a volunteer.
I was diagnosed over 40 years ago with a condition called obsessive compulsive disorder, which is a very nasty condition. And I really didn't know which way to turn. I didn't know who to approach. And I rang a support group associated with the Mental Health Foundation, the Obsessive Compulsive Disorder Support Group as it was. And this was really my introduction into the Mental Health Foundation. But I remember that phone call. I didn't even tell my wife that I had this problem because I didn't have a name for the problem. I didn't know what it was. Completely ignorant about mental health issues. And I rang someone on the phone and they basically said, look, what you're experiencing is very common. People don't talk about it, but you are not alone. You are not alone. You are on the map of human experience, was the message that I took. Because prior to that I thought, God, I must be an alien. I must be completely different. Nobody else can be feeling these things and behaving this way, you know, and trying to cover it up. What is wrong with me? To hear those words was just like somebody coming and putting a warm blanket over me and saying, you know, you're not crazy. This is just a common condition. You know, there are treatments available for you. You have a community of people who can help you and who can assist you. That's the beauty of support groups.
The main benefit that people get when they attend our support group program is a sense of belonging. They like to share and they like to receive and they have their experiences that they talk about. They basically enjoy coming in and feeling less isolated. It takes a lot of courage and bravery for people to step through the door here at the Mental Health Foundation. People experience fear, anxiety, shame and sometimes embarrassment that they have to come in and actually get help for their condition. When you are diagnosed with a condition, it can be a hard learning curve. They know that if they come in here and they brave their souls, that they will receive the support that they need to help them negotiate and navigate their world. The best part of it is when they actually will give the verbal feedback and say, I didn't want to be here, you know, I had to cry, I cried in this meeting, I'm so embarrassed. And we always reassure them that there's nothing to be embarrassed about and it's an absolute safe space. And they're just so grateful. And that's, for me, the complete reward.
The cost of services are rising, the cost of living, the pressure of life is increasing, and many people are struggling with the impact of changes in life, particularly after the pandemic, on their lifestyles. That's making an impact on their mental health.
And during pandemic, we also provided 165,000 meals in 200 days. When everyone were locked in, we were locked out.
Well, we do a number of things. The last couple of years introduced a very innovative program called our Wellness Hub.
I would describe the Wellness Hub as inclusive, supportive and affordable. The low-cost counselling that we offer really benefits the community, especially people who are financially disadvantaged, who can't afford private practice fees, and as you know, the public mental health system is often overwhelmed, so at times it can take 6 months or more to even get a triage or any appointment. So our service aims to support the public mental health system. It has been a very rewarding and fulfilling experience to know that I'm a part of something bigger to support the community with their mental health.
In Australia, there are many well-meaning services, organisations that support people with their mental health and well-being. we have a very strong community focus, and really the history of it over many decades now has been really working with small communities, with larger communities, with multicultural communities. We work tirelessly through many ambassadors, volunteers and great staff to really engage with community, to engage with these multicultural communities in Australia. And we are, as a unique organisation that really works on supporting these cultures, these different communities. Mental Health Foundation of Australia is pivotal at trying to break down those barriers for our community.
We use technology to develop tools to raise awareness, educate and support the community. And one such initiative is the Supportive Mind app, which is a self-help mobile app technology that promotes holistic approaches to mental health and physical well-being. Through social media, we raise the message that it is okay to talk about mental health, your feelings are valid, and seeking help is a sign of strength.
The podcast named Empowering Voices of Harmony, which focuses on telling powerful stories of people with diverse backgrounds who have had some just mind-blowing journeys. It's been very interesting. I mean, we've had people from multiple backgrounds, different stories. So it has been a sort of a journey for myself as well to explore it.
I believe my journey started with MHFA because I wanted to get involved with an organisation that really cares for multicultural mental health, particularly for all communities. I find that, there are some communities that struggle with talking about mental health.
The thing with Mental Health Foundation Australia that really inspired me was its multiculturalism and how it targets not only one specific group but all groups, and I suppose is quite inclusive. And I guess multiculturalism across the board is not a focus of a lot of foundations. It's very much young people or one particular group. But with Mental Health Foundation Australia, I was really keen to sort of contribute to a multiculturalism across the board.
The main point of the media team is to communicate the organization's missions of promoting better mental health for all to the world. We aim to reach as many people as we could to offer help, support and hands to enable them to overcome their mental health issues or help their loved one.
It has given me a lot of opportunities to nourish my skill and understanding. Working as an active member of the team has given me a great sense of personal belonging to the community, and it actually also uplifted my confidence to continue working as an advocate in the mental health field. And I think I will continue working as a mental health advocate with Mental Health Foundation Australia.
It's a challenge without much government support. How we are strengthening ourselves is purely because of our handful of dedicated and committed staff, with the support of volunteers and interns coming from various universities in Victoria. It's a difficult challenge when you don't get much support from the government in relation to run this organisation.
It takes money, you can't do it for nothing, and we do need your support. We run on a shoestring, so get in there and support the Mental Health Foundation Australia.